Your testosterone came back at 510 and your doctor said you're fine, but you still feel exhausted and you can't concentrate past 2 p.m. But you're not wrong to question it. As a medical doctor specializing in men's hormonal health, I review panels with 5 categories, usually 40 markers or more on men. But when I see a standard GP panel, it's usually only testing 1 or 2 markers. And that gap can explain why you still feel terrible, even though it says you're normal. Now, I want to talk about why normal is actually the wrong benchmark, because the reference ranges in your lab report is made from population data. A broad sample of adult men who are usually sedentary or overweight. And then you have a few who are actually thriving and lean and in good health conditions. So the bottom of the range captures men who are symptomatically declining and not feeling well. And the top of the range are men who are doing excellent and feeling very good. But both get the same label, which is normal because you can have a 45-year-old at 510 and you can have a 25-year-old athlete at top physical shape at 900, and they would both be labeled normal. And so this is not an issue in terms of what's normal is. It just tells you what this standard test actually measures. Because normal is a statistical description of a population. It says nothing about what is optimal for you, your age, or your goals. And even within the markers that are sometimes checked, interpretation is usually incomplete without the context. Here are the 5 categories that I check that most panels skip entirely. First category is binding markers, because total testosterone tells you how much is circulating, but most of it is bound to a protein called SHBG. And so this makes it biologically inactive. So without SHBG and free testosterone in your panel, you could have normal testosterone levels, but it wouldn't mean anything because now we're lacking context. Last year, I reviewed a patient who had total testosterone of around 680. But his SHBG was 74, which put him at the bottom 5% of free testosterone for his age. And repeatedly, he'd been told that everything was fine. So that's why measuring your binding markers is important. Before I go to the next category, I just want to say that I've created a quiz, hormonal quiz that you can take in less than 2 minutes. The link is in the description below, and it's going to tell you where you are approximately on this panel. Nothing beats a real blood work panel, but this can help you a little bit. So, next category is estrogen markers, because estrogen is produced normally. It's not pathological. We need it for our bones, we need it for erections, and we need it for mood. If you have too much estrogen, you will retain more water and you will have mood issues, and you might even have erection issues. If estrogen is too low, you might have joint pain and declining bone markers. And so for men, estradiol, the optimal range is very narrow, and I've never seen it on a GP standard test panel. Now let's talk about your pituitary signals, because this is where we have LH and FSH. And why do we even test this? Because you can have high LH, high FSH, which would then indicate that you have a primary issue, which means your testicles are not producing as they're supposed to do. LH signals to the testicles to produce testosterone, and FSH signals them to produce sperm. So when you have high LH and low testosterone, this is what we call primary hypogonadism, which means, again, the testicles are not producing as they're supposed to do. If you have a low testosterone and low LH, it's pointing towards secondary hypogonadism, which means your brain is not signaling properly to the testicles to produce testosterone. And so this is usually the cause, and testosterone is then the result. Here we also have prolactin, which is also produced in the pituitary gland, which can then suppress your LH production and thus suppress your testosterone production as well. So you could have high prolactin, which is the main reason for you having low testosterone symptoms. And this is almost never checked by GPs. And then we have the fourth category, metabolic markers. This is where you have HbA1c, because this measures insulin resistance. And insulin resistance is one of the biggest drivers of low SHBG. This suppresses LH signaling and thus testosterone production. This is one of the biggest modifiable factors that you can do and you can fix yourself. We also have thyroid function, because subclinical hypothyroidism will increase your SHBG, which then reduces your free testosterone. And we know that free testosterone is actually what's active and what's working in the body. So a man with a thyroid problem and marginally low testosterone might be solving for the wrong issue. And now the fifth category, well-being markers. This is where we have cortisol. This is where we have ferritin. You can have ferritin deficiency. You can be low B12. This will create hormonal dysfunction in men who otherwise look healthy. And these are not exotic tests. They're basic, but they're skipped, unfortunately. So to summarize, a standard GP panel was made to diagnose disease. not to look at if you're optimized or not. It's the right tool for the intended purpose, but it's not the right tool if you want to know where you can optimize and what you should do. The 5 categories, the binding markers, estrogen markers, pituitary signals, the metabolic markers, and the well-being markers are all needed for you to really understand where the issue is and what you should do to improve. And if you want a starting point for what your panel might be missing, there's a link, as I said before, for a quiz. It's a hormonal audit. It takes less than 2 minutes. It tells you where you are and where you can do yourself to get to the next level. After finishing the quiz, you get an offer to get on a call with me or one of my colleagues, and we can have a look at what we can do to help you get to that next level faster and more efficiently. If you're not interested in that, that's also fine, but at least take the hormonal quiz. Now, if you enjoyed this video, like it, subscribe to the channel, and I'll see you in the next one.